All right, we are back on Morning Line with Clint Kelly. Every time he comes on this show, I learn from this guy. He's such a bright fella. He's a malpractice attorney. If you want to join in the conversation, 737-7587. You know, I get a couple emails every once in a while from people asking me, how's the baby doing? And this was a story that went national, and it was a case that Clint handled, and we did a story on it and broke that, and it was about an infant, you may recall, locally at one of the hospitals that was given a surgical procedure not long after the child was born without the parents' consent or knowledage, because it was a mistake, right, Clint?
Correct.
Now, what was it again? It was the
frenulectomy. That's right, to relieve a tongue tie. And mama sends the baby to the nursery thinking that the baby's going to be examined. The baby comes back and the baby's bleeding inside the mouth, and she's asking the nurse, you know, what's going on with my son? And the nurse looks at the paperwork and says, oh my gosh, you're going to need to talk to the doctor about this. Doctor calls, you know, the room, you know, some 15 minutes later and says, I made a mistake. I operated on your child when I was supposed to operate on another child. I got the names mixed up. And
yeah, you admitted it.
Admitted it. Mm-hmm. And of course, he didn't come to the room and apologize to her face to face, but that's another issue. Mm-hmm. You're asking how the child's doing. Right now, the child, is, my understanding, is doing pretty well. Yeah. Mama's the one having the problem.
Sure.
And that's going to take some time to work her way through, because she's been bruised emotionally and in her own sense of self-worth as a mother, because, you know, mothers are supposed to be the protectors. And there's always some inevitable guilt, even though she didn't do a single thing wrong.
It's not her fault, of course not. And the good news, too, again, the frenulectomy, hopefully, in case, and we don't know until the child gets older, but I mean, that's not something, it's not like they went and removed a kidney, all right, right? I mean, this is a child that hopefully will be okay. This is not some, I can think of far worse surgeries they could have performed on this child. That's what I'm saying.
I think the problem with her is when she takes her child to another doctor, particularly is the child still remains in tender years. How much do you trust the doctor to do the right thing after you've been burned like that?
And this is something that
reduces your confidence and loyalty to the medical system when something that bad and that preventable happens.
Okay, so we're talking right now, and someone at home listening is a mother-to-be, pregnant perhaps right now, or is planning on becoming pregnant and wondering, oh my gosh. And you've advocated this, and you said some hospitals are already doing this, where they're no longer sending the infant to a nursery.
Correct.
That they are going to set up that little incubation chamber that keeps the child warm when the mother's not holding the baby, right next to the bed in the room. Because that's, if I'm a woman out there sitting there about to have a baby, hearing what you just said, I'm like, well, how do I prevent that from happening to my child? It was an accident. No one meant to do it, but it happened. There's supposed to be protocol for that, and it still happened. What do you think?
We're talking about a healthy child now. We're not talking about an unhealthy child.
Right.
But there is a move afoot for healthy children to simply stay in the room with mom and dad throughout the hospitalization, so that the baby can be watched and cared for, so something like that doesn't happen. Remember, we had baby theft for a while.
Remember
that was
they had to
going
do
on,
the wristbands.
And I don't know if that still goes on, but that's been one of the solutions that have been advocated, is to have the baby in the room with mom and dad throughout the whatever 2 days you're in the hospital.
Throughout the 2 days that you're in the hospital. All right, I want to just give people the basics again. As we said, you know, the statute of limitations, we talked about how important that was to go about. If someone has a case and, you know, maybe wants to contact your office, again, it doesn't cost them anything to make the phone call.
Correct.
They probably won't talk to you directly. They'll talk to your assistant at the office, right?
Right.
What are the basics they need to know about their situation to convey?
Obviously, what happened, they're going to need to tell, you know, where they were, whether it's a hospital, which doctor they were seeing, what happened to them in their own words. When it happened. It's very, very important we know when did the event occur, and what are the damages, what problems is the patient going through today as a result of the medical mistake or neglect that otherwise wouldn't have occurred. I mean, if it's death, it's obvious, but if it's someone who's lost a limb, lost eyesight, someone who's had brain damage, those types of things, you know,
suffered bad scarring?
Bad scarring, sure. Just be prepared to explain that, or have someone who's a close friend or family member be able to explain that to our staff, so that we can get a full picture of what happened.
How easy is it for you to get, or for them to get, medical records? I'm just curious. I mean, it's theirs, and I can't think. You know, I go to the hospital and stuff, and they've got the file. Can I go into my physician's office? I guess I want my file.
Yes.
And they have. I mean, I've never asked for that. I've never had a reason to. I've got a great doctor, but I mean, you can just go in. You should be. Now, can they give you a runaround?
They're required by law to give you your medical records.
Okay, I want my file.
Yeah.
Give it to me. Are there x-rays in there or whatever?
Their federal law and state law requires them to provide your records upon request.
Okay, and from hospital, have you dealt with a situation ever in a hospital where they do give you a runaround, or that the records have been tampered with?
The latter.
The latter?
Yes.
What do you mean?
I have had cases where the records are tampered with. Now, I'll tell you what's happening. It used to be you could look at a handwritten chart and you could tell whether someone had added information to the chart. That's usually how it would happen. Someone would add something on there and try to use the copy machine and put it. You can tell.
Okay.
You can tell. They're handwriting specialists that can do that. But that's the old-time medicine. Now the new medicine is electronic medical records. And what can happen now is a nurse can enter some information electronically, come back to the chart after the fact, and just simply change, like with a keystroke, go onto a drop-down menu and change one word to another and have it flash back up. The way to detect that is you get what's called the metadata. That's the actual electronic data that supports the chart, and look to see. It will tell you.
Have you done that? Will you get that? And
yes. Yeah.
And then you'll say, oh, what's this here?
Yeah. We use Microsoft Word. People don't know this, but you can go into Microsoft Word and tell every date and time you edited a document. That's part of what's called the metadata. You can do the same thing with a hospital chart.
So you've gone in there, and that's where you find a smoking gun that you can bring up.
Yes, if there's been a change.
Isn't it true, too, also, sometimes your best witness isn't help with the nurses?
Yes.
But two, you've also said that a lot of times now nurses are doing more than ever before. The doctors maybe, I don't know if they're overworked or they're out on the golf course or what, but the nurses, I mean, when should you expect to see a doctor and not a nurse? I mean, and can that get into it? A nurse sometimes overstepping the bounds of what she truly is qualified to do because the doctor's not there?
I don't see cases where nurses overstep the bounds on purpose. What I'm seeing cases
they're left holding the bag.
Exactly. They're being required to perform more and more functions that were traditionally performed by either medical doctors or physician assistants. And because of the nature of the hospital business as it is right now, they don't communicate like they used to, either because they have too many patients, they don't have the time, or there's not an environment that encourages communication between the physicians and the nurses. So the nurses will simply take an action, and they won't communicate either to their other nurses or to the doctor. Horse gets out of the barn and nothing can be done about it. Classic example is wrong medication.
Yeah. Okay, meaning that the nurse gives the wrong,
Correct.
or the medication's given twice, or there's a medication given and a different one's given that has a reaction.
Right, or the patient has signs and symptoms suggestive of a major disease process or a major condition, and the nurse does not relay that information to the physician so that the physician can make an informed judgment.
I thought it's supposed to be getting better than ever before now because everything's electronic. They can type it in there. You can get in there on the computer.
It's getting worse. It's getting worse. The electronic medical records was a way that we could standardize the process so one hospital could communicate with another hospital or one clinic to another clinic, and everybody could be on basically could have access to a patient's entire health chart. Okay? The flip side of that is doctors and nurses spend more time filling out the chart electronically than they do treating the patient. We call it treating the chart versus treating the patient. And because the volume of patients continues to swell, the margin for error gets smaller and smaller. That's why it's getting worse.
And the hospitals, it never ceases to amaze me. Knock on wood, I've been relatively healthy, and I think you have too. Whenever I go over there for a story, and I'm sure when you go over there to visit a client or something, I am always stunned. I don't care what hospital you're talking about locally. They are packed.
Yes.
Packed. And then one thing we didn't touch on, I want to hit on this real quick, is hospitals are sick.
Right.
By definition, meaning MRSA.
They're dirty.
They're dirty. You go in there, you've said well, of course you don't want to go to a hospital unless you have no other choice, but you may go in there for one thing and get something else.
Right. A lot of times you'll get an infection.
Oh, that's great, Clint.
I think it's 1 out of 4 patients now they've shown statistically will come out with some type of infection.
Some hospitals cleaner than others?
Yes.
Okay, so how would you go about determining whether or not, I mean, I could pick which hospital I want to go to maybe. Is there a way to find out which one may be the best one to go to for cleanliness? And
word of mouth. I know because I do this business.
Because you know, when I'm in trouble, I'm calling you.
But hospitals are not required to report their infection rates to the public. They don't have the same requirements as some other professions do in terms of reporting bad outcomes or bad situations. I may have to report to the government because they get Medicare, Medicaid money.
Justify
but
that. Yeah.
Word of mouth is the best way to go without calling me.
Yeah.
I know who they are, but word of mouth is the best way to find out.
Word of mouth, but it's, investigate it. You just assume certain hospitals, and it's not all their fault. It's just so dang packed.
Well, some hospitals, I believe, are more conscientious and more thorough than other hospitals, and there are a variety of different reasons. And some hospitals are better for certain things than others,
yeah, that's
too.
true. That's true as well. But some are known more for heart, some for cancer, that kind of thing. Diagnostics.
You have to ask. You have to be as informed as possible. You just don't want to go and show up someplace and say, "Okay, I'm sick." I mean, if you're in a trauma case case, you know, and you're being airlifted somewhere, there's not much choice you have. But if you're going in for a routine surgery, you can ask a lot of questions in advance to make sure that things are being done right.
I don't mind telling you, I went in recently for a colonoscopy, but I didn't really research where I was going. It worked out fine. They played Greek music as I was put under, and I came out and it was over in a heartbeat, and I've had no ill effects, but it was just a small clinic actually for something. And that's a fairly routine procedure, but even that can go awry. So you want to know, I mean, I just trusted my doctor who referred me to this, saying this individual's very
And
good.
Nick, there is some element of trust we're just going to have to give no matter what.
Just
There's
have
only
to.
so much research you can
As
do.
it is in life. Clint, remind folks where your office is.
It's at 629 East Main Street in Hendersonville. Phone number 615-824-3703. You can see it on the TV.
Yep.
Call is free. Consultation's free if we take your case. You pay nothing unless we recover money for you.
And don't wait.
And do
even if you're not sure, and today we didn't get as many calls throughout, it may just be a slower day, but a lot of people watch and maybe they're going to do some research. If you have a suspicion, it doesn't hurt to make the call, and if you have a case and you wait over a year, you're toast.
Yeah, just please pick up the phone if you think something bad's happened to you, because you don't want to be one of those people that waited too long and have to be told you don't get your day in court.
Clint, that
Thank you
was a
so
great
much.
conversation. I really
It was.
enjoyed. Wait, when they tell me Clint's coming on tomorrow, whatever, I look forward to it. It's good to see you, my
Good to
friend.
see you
I
too.
appreciate you coming on. We'll take a break. When we come back, I'll have that number back up for you if you want to grab a pen and paper if you missed it the first time, and have a programming note about tomorrow right after this. Stay with us.